Okay, so I made a pros and cons list for MRI. The first one, obviously, there's no ionizing radiation, so you don't, unlike x-ray, you're not exposing yourself to radiation. Next, the exams are a lot longer. We're looking at like 20 minutes to an hour, so you have a lot more time to connect with your patient, and the day goes by a lot faster. And then I would say MRI is really satisfying. You're angling your pictures with different anatomy parts, and so when you get your pictures to pop up and they're perfect, it's like really nice. This next one I consider a pro because it was always one of my like long-term career goals to learn IVs. This could be a con to some people, but I think it's kind of cool. And then of course MRI gets paid a little bit more. The average in my area for a full-time MRI tech is about $76,000 a year. And then, of course, there are some cons. It's a different physics than x-ray, so if you start as an x-ray student, going to MRI can be a little bit more challenging just because you have to learn a completely new physics. And then this probably isn't really a con, but safety in MRI is very important, so it can be kind of stressful sometimes. Patients can get really frustrated with how many questions you have to ask them, but it's just all for safety. And then the last one, time restraints. The exams are pretty long, so you definitely have to have good time management skills in MRI. It can be very stressful to run on time with a large outpatient schedule and then trying to fit in inpatient exams as well. But this also depends on where you work because some places give you a 1-hour time slot for patients, so you are able to fit in inpatients in there, but some only give you 45 minutes. But yeah, drop more comments below and I will answer your questions.